E. coli can cause severe hospitalization. This child has something called hemolytic uremic syndrome, or HUS. And as a parent, I know these headlines can be scary, but let's talk about what's going on and what you really need to know. Hi, I'm Dr. Mona Amin, board certified pediatrician and mom of two, and I've seen these rare conditions that you probably read online. So hit that follow button if you want to make sense of these scary headlines with actionable tips that won't keep you up at night. HUS is a rare 2 to 3 cases per 100,000 people, but serious condition that can happen after certain diarrheal infections, especially from a specific type of E. coli called 0157H7. What makes this strain of E. coli different is that it produces a Shiga toxin, which damages blood vessels, especially in the kidneys. That damage can lead to the triad of kidney injury, anemia, and low platelets, which is classic for HUS. With HUS, your child may start with just diarrhea, maybe even bloody diarrhea, but the following symptoms begin 5 to 10 days later: fatigue or unusual sleepiness, pale skin, easy bruising, swelling around the eyes or ankles, less urine or fewer wet diapers. If your child has had bloody diarrhea and you see any of these symptoms, check in with your doctor. Now let's talk about where this bacteria comes from. Yes, undercooked ground beef is one source, but in my own training, the HUS cases I saw all came from kids who swam in lakes, ponds, or bodies of water. Lakes and ponds carry higher risk for E. coli than oceans. Why? Because they're still, warm, and can collect animal waste, farm runoff, or sewage, especially after heavy rain. Oceans, on the other hand, have salt and strong currents that help break bacteria down. But even ocean water near storm drains or after rainfall can carry that risk. So what can you do to reduce the risk without skipping the beach or the lake? Check local water quality reports before swimming. Most cities or counties post updates online. Avoid swimming for 24 to 48 hours after heavy rain when runoff is highest, especially in lakes. Don't let kids swallow lake or pond water. Practice blowing bubbles instead. And if you're unsure that they'll be able to do that, keep them out of lake or pond water until they're capable. Shower or rinse off after swimming, especially in lakes or ponds. Wash hands well after swimming or visiting farms or petting zoos. And of course, cook ground beef thoroughly, wash fruits and vegetables, and avoid raw milk and unpasteurized juices. So while this is something to stay informed about, especially in the summer months, there are simple steps you can take to help reduce risk. And if this helped you feel more informed, share it with another parent who might be seeing these headlines too. And follow along for more pediatric guidance that keeps things calm, clear, and rooted in real care.